listener production.
Hello, Natarsha Belling with you. Welcome to the Briefing Afternoon Edition. Coming up in our deep dive, Australia's new health crisis. The rates of sexually transmitted infections, or STIs, are skyrocketing. We chat with a leading GP to find out why it's affecting a growing number of Australians of all ages and the urgent need for a new hard-hitting education campaign. But first, let's check the afternoon headlines on Monday, the 17th of March. Former Prime Minister Malcolm Turnbull has lashed out again over Australia's alliance with the US. Mr Turnbull has slammed the AUKUS deal, the $368 billion nuclear submarine pact with the US and UK was signed by former Prime Minister Scott Morrison. Here is Mr Turnbull earlier today in the halls of Parliament House.
AUKUS is a terrible deal. It is so unfair to Australia. So people say, will Donald Trump like it? Well, of course he'd like it. It's such a bad deal for us. His only thing would be back of his mind, he'll be thinking, who are these dumb guys that agreed to this deal?
Mr Turnbull says we're pouring billions into US nuclear submarines, but there's no guarantee we'll actually get them. Labor is bracing for the financial fallout from tropical Cyclone Alfred, setting aside at least $1.2 billion for recovery in next week's budget. The Federal Treasurer, Jim Chalmers, says the storm's also expected to slow our economy.
That's about 1/4 percentage point in GDP. And we also anticipate that there will be some impact on fruit and vegetable costs, depending on how much of the farmland has been impacted.
Authorities believe a 6-year-old girl who went missing from her home south of Sydney yesterday died from a tragic accident. Airlie Montgomery, who reportedly suffered a number of medical conditions, disappeared from her North Nowra home late yesterday afternoon. Her body was found about 4 hours later in a waterway in nearby bushland. Now it's time to get into our deep dive with Dr. Ginni Mansberg on why we're seeing a concerning increase in STIs. Some rates are doubling or even tripling, leading to greater rates of lifelong health problems and in some cases deadly cancers. Dr. Ginni is just one of many leading health experts that say we now need a new education campaign about the importance of safe sex and the deadly dangers of ignoring STIs. While this is an important chat to have, we would like to warn you some of the details in this interview could be confronting. Ginni, thanks so much for joining us. Let's start with the latest data that we have available right now about the rate of STIs in our country. It comes from the Kirby Institute's latest annual surveillance report, and it shows the diagnosis of gonorrhoea has doubled from 2013 to 2022, while cases of syphilis have tripled. These rates are terrifying.
They are. Congenital syphilis, which means babies born to mums who were infected with syphilis while they were pregnant, they went from 3 in the last survey to 30. I can't believe we have congenital syphilis. It was the kind of thing that I learnt about in med school as a theoretical thing that I would never see in my entire life, and it's back. It's just wild.
So what's going on? Why are we seeing this reemergence of STIs that back in the 80s and 90s had almost disappeared?
So I think we need research to really know for sure. And like everything, we're always tempted to give a simple solution to a really complex problem. So this didn't happen overnight. And I think there are lots of things going on. Initially, my thought was, maybe we're testing more, but it turns out that we're testing less. So that was other data from the Kirby Institute, was that actually testing rates have gone down and people are like, I don't want to know about it, and they're not getting tested. So this could be a drop in the ocean. The numbers could be far worse than the statistics you just quoted. But I guess there are a few things going on. First of all, I think when you and I were teenagers, we were right in the middle of the Grim Reaper campaign and we were all about safe sex. Everybody knew you had to wear a condom. We all knew about these messages. And then we kind of got on top of the HIV/AIDS epidemic, and we went, you know what, don't need those ads anymore, don't need to scare everybody anymore. And we kind of stopped talking about it a little bit. And I think there's an entire generation of younger people who have not got the message about safe sex. And even in our generation, because we've got high rates of divorce now, women in their 40s, 50s, 60s, they're often not vaccinated against HPV. They've been in long-term relationships where wearing a condom was just not a thing that they did, and all of a sudden they're in a new relationship. And the penny hasn't dropped that these things are still out there. Just because it's not in the news, just because we're not seeing ads from the government, it doesn't mean they're not out there. And I think it's just a matter of doing what you and I are doing now, having a chat about it, talking about it, being really open and honest about it, which is going to get it back in the minds of people so they can start taking preventive action, which can be done. We know that because of the HIV epidemic, what we managed to do with that just by increasing condom use.
Ginni, in regards to the danger of STIs, as you mentioned before, we grew up in the 80s and 90s where we had the Grim Reaper ads, and we led the world in HIV prevention, Australia did, because these ads were terrifying. I think they came out in 87, but they were incredibly effective. What concerns me really greatly about this spike in STIs is they think that you can live with STIs, and there's a misinformation campaign out there at the moment that just because you have an STI, it's not a big problem. Can you go through some of the serious health risks and complications you can get if you have a sexually transmitted infection?
I think to unpack what you just said a little bit there, Tash, I think we've got to celebrate the fact that AIDS has gone from a death sentence to a chronic disease that you live with now. And I think the amazing strides forward in research and implementation of drugs that we never thought were possible is something that we need to just stop and acknowledge, because it is incredible. And sexually transmitted infections can range from something like a chlamydia, which we think we're only seeing like maybe 1 in 20 people that actually have it are coming forward. Our notification rates are low, but that can be a bit inconvenient, maybe a bit of a discharge, but there are going to be certain people who are going to get infertility from it, who are going to get chronic pelvic pain from it. So that won't happen to everybody. But you've got things like the human papillomavirus, which is a vaccine-preventable illness that is responsible for cervical cancer. Now, in this country, we are, again, absolutely hands down the world leaders. We have converted the most common cancer killer of women worldwide into a rare disease in Australia. And we should be celebrating that. That's a combination of the fact that we are leading the world with our PAP testing, which is now we call the cervical screening test. We've got amazing vaccination rates of both girls and boys in school now. We have done all of those things, but we've got to remember that cervical cancer is a potentially lethal disease. And we can't just sit there and go, oh, really, it just doesn't matter. Let's not stigmatise people and shame people who have STIs. I agree with all of that, but that also does not mean don't take it seriously. For my patients who get genital herpes, and it's really common, we think 1 in 8 Australians carries genital herpes, the horror and shame that so many women feel about having this condition, whether to disclose it and when to disclose it to a new sexual partner, it is a really awful thing because we don't have a cure for it. Now, not everybody is going to have horrific symptoms. Many people's symptoms will be so mild that it only affects them a few times in their life, and they're quite mild symptoms at that. But for some people, there is so much stigma there. And because we have done such a good job of saying, just because you have an STI, don't think you're dirty, somehow in that messaging has also been, and it's nothing to worry about. It is still something to worry about if it happens to you.
And what about gonorrhea and syphilis? What are those? You know, we mentioned those before with the stats. The diagnosis, as I mentioned before, of gonorrhea doubling from 2013 to 2022, and syphilis have tripled. They're very serious STIs, aren't they?
They can be. So gonorrhea is one of those diagnoses that you just go, what? How did that happen? That, again, can lead to infertility and chronic pelvic pain in women. I mean, I feel like women bear the really big brunt of most of this. Of course, HPV causes, penis cancer as well, but that's very rare. Most of the burden of illness is borne by women. But this gonorrhea can be a really nasty condition if we don't get on top of it and you do get what we call pelvic inflammatory disease. But syphilis That is a disease. It's a bacterial infection that can go everywhere. It can go to your heart. It can go to your brain. It can cause all sorts of terrible problems when it comes up again and again and again. And if you're pregnant, it can really cause quite severe brain damage to your baby. And we just don't want to be seeing that in this day and age because it is treated with antibiotics that are bog standard antibiotics. We do need to talk about rates of antibiotic resistance, particularly in gonorrhea. That is emerging. And we were seeing that overseas and just reporting that and like, oh, that's just interesting. We'll keep an eye on that. And now it's happening here in Australia. And you don't know whether the gonorrhea that you're going to catch is going to be one of those ones that needs a super weirdo, nuclear bomb of antibiotics that we keep up our sleeves for the rarest cases, but we are needing to use that these days.
So you're now even starting to see incidents of antibiotic-resistant STIs.
Particularly the gonorrhea. We are really seeing a lot of that in Australia. And I feel like that's happened really quickly. We knew it was a theoretical risk because we were seeing it overseas, and now we have it here.
So, Ginni, in regards to testing rates, you made a really interesting point earlier, the fact that the rates of STIs could actually be much higher because people aren't getting tested. Where can you get tested, and what do we need to see change to make sure that people feel comfortable getting tested?
So I think that's such a great point, Tash. Where you get tested now is at a GP, or if you feel really, really uncomfortable, you could kind of drive across the other end of town and go to a random medical centre where you hope to never see anybody ever again. That's difficult if you're in rural and remote Australia. Or you can go to an STI kind of clinic that tend to be run out of public hospitals. Well, that's a bit awkward, and not a lot of people want to do that. And what we're seeing is a real lack of engagement around testing because so many people are feeling the stigma and feeling the shame and feeling that kind of they almost don't want to know, and also feeling, like you said, that it's not that bad and I don't really need to know anyway. It's really complex. But one of the things that I would love to see happen in Australia that is definitely happening overseas is DIY testing. So doing it yourself at home, where you can order a kit online, weigh into a cup, kind of a lot like a COVID test, but sort of doing it off urine or off maybe a bit of a discharge, something like that, where you can find out for yourself and then decide what to do with your next steps. That's not committing you to go and seeing a doctor, but it's at least giving you some information where you then can Google and decide what you're going to do, decide whether you're going to tell your partner or partners. But I think for so long as we keep doctors as the barriers, as the gatekeepers of these tests, we are going to continue to see people slip through the net and potentially babies born with congenital syphilis, women being infertile from gonorrhea or chlamydia that they haven't diagnosed, and cancers. And I think that's a real missed opportunity for a wealthy country like Australia.
We know, as we saw back in the 80s with the Grim Reaper, the most effective way to dramatically decrease STIs is through safe sex using condoms. We know now the stats show that a concerning number of people don't have safe sex. How do we turn this around? Do we need a new education campaign?
I think we do, and I think it's got to be clever. I think there was a lot of criticism of the Grim Reaper campaign when it did come out as being overly anxiety-provoking, as overly stigmatising people with HIV/AIDS, and perhaps there can be some middle ground. But I always laugh when I think about the Mean Girls movie, and if you remember, the coach stood in front of all the kids at school and said, don't have sex, because if you have sex, you'll get chlamydia and die, so just don't have sex. And that was the end of the conversation. I think we need to have maybe the middle ground between simplistic, maybe silly conversations and scaring the pants off people, and allowing people in a safe space to come forward, get their questions answered. And maybe we need to anonymise access to treatment, anonymise access to testing. Doctors do not need to control everything here. There has been a real fear that if somebody diagnoses themselves with HIV/AIDS or syphilis or something like that off a home test and they don't have a doctor to sort of explain it all to them, they might do something terrible, really not cope with this test result, and it might all go pear-shaped. I think we need to have more respect for humans and stop throwing sand in the gears of people actually taking their health into their own hands. We are increasingly, Tash, getting evidence that people who have this self-efficacy, this self-empowerment when it comes to their health have better outcomes, and they certainly feel better about their health. And if that is all, then let's make our patients our partners in their own healthcare journey, because at the end of the day, we are not solving this healthcare professional crisis. We have a crisis of access to GPs. We don't have access to nurses. We don't have the people on the ground that we need to actually allow people to get the healthcare delivery that they need. So let's get that sorted. Let's make people equal partners, co-pilots in their own health, and remove the barriers to access for testing and even for treatment as well, because that is what is going to be improving the outcomes for Australians.
It's such an important topic and we really appreciate your insights. Thank you, Ginni.
Thank you.
That was Dr. Ginni Mansberg there. And that's it for this episode of The Briefing. We would love you to share this episode with someone you think may enjoy it. And if you want to keep up with our other content, you can check us out on our socials, including Instagram at The Briefing Podcast and on TikTok and YouTube. You just need to search The Listener Newsroom, which is LISTNR. And we'll be back in your feed tomorrow morning from 6 a.m. I'm Natarsha Belling. We'll see you tomorrow afternoon.